All right. Well, we are here for September Grand Rounds with Dr. Christina Migliara, who we are super excited to have with us. Christina, I've actually known for, gosh, probably a couple of years at this point. And she wrote a wonderful article for us this week in the newsletter. And to give everybody a little bit of background about Christina and what she's doing, she is an affiliate owner, CrossFit Tailwinds. Is that right, Christina, in Florida? And has really taken the lead on health home creation, uh, centering a lot of the work that they do in the affiliate around mindset and mental health, but they also have different forms of therapy, including physical therapy, and other provider services within the affiliate, which is fantastic, all under one roof. So, really, truly a visionary and melding her two passions for fitness and the role that it plays in mental health and well being. It's also really important to note that, Christina was at the games with us and very quickly recognized the need for support of athletes and community members while we were there, and was a big instigating force in bringing everybody together to provide services to folks in real time and helping to coordinate everything that happened through the medical society afterwards. So we really owe her a huge debt of gratitude. And she actually volunteered to kind of move up her slot in the newsletter and to be with us for Grand Rounds because of the importance of discussing this topic after the tragedy that happened at the game. So, really excited to have you here and to share more with us. From a CV standpoint, correct me if I'm wrong, Christina, but you have a PhD in psychology, I believe, licensed marriage and family therapist, and have additional training in trauma, which I think makes you uniquely positioned to speak to a lot of what our community has been going through over the past couple of months. Anything to add to that I forgot that's important from a bio standpoint?
I don't think so. I mean,
Okay.
addiction and trauma, they kind of go hand in hand, to be honest with you, but that's primarily what my historical roots in the clinical world have been.
Fantastic. Well, without further ado, I will hand the stage over to you and we'll get running. And then, folks, if you have questions, please, while we are going and while Christina's talking, put them in the chat. We will interject in real time if appropriate while Christina's presenting. And if not, we'll make sure that we leave some time at the end of today's discussion to try and get to all the questions and have some live Q&A. So Jen will be keeping an eye on that for us. All right, Christina, it's all yours.
Awesome. Well, thank you for having me and for that amazing introduction. It's an honor and a privilege to be among all of you fantastic folks here. One thing I love about the Medical Society and this kind of coming together is it takes the two things that I think most of us can say we're passionate about, which is health and CrossFit. And I feel like at that point we could geek out over this kind of stuff for hours. And it just makes us like that much more passionate because I've never met a CrossFitter who isn't passionate about CrossFit and, accompany that with healthcare. I think those two things just really make us a unique type of human in this space. So I'm pretty excited about that and been excited about the Medical Society coming to fruition. So it's really cool to see that. I think it's interesting that the timing of it and with the games kind of coming and then things sort of unfolding, we really had a unique opportunity to, um, you know, go into something that I don't think that we were necessarily planning for. And it wasn't necessarily on the list of top priorities for the Medical Society, but it really was an opportunity to showcase, what the potential is here. And I felt very proud to see all of the providers coming together, particularly the mental health providers stepping up and coming in. And I know that there's a lot of work still being done on that front, and we've been a part of that as well. So that's been really helpful to not only intervene at the time and do some crisis management, but also, you know, um, we're now a little bit over a month past that, and good work is still being done. And we're able to utilize the CrossFit Medical Society to bridge that gap for lots of the athletes and spectators and community members who are affected. We're still getting outreach, and it's really awesome to hear like, hey, I heard about you from the CrossFit Medical Society and was able to come see you. So I just think that that's just one way in which this platform is going to be used, not just for mental health and for this particular situation, but as it unfolds, all of the different services that are being provided through this platform. And that's just awesome to be able to see that. So kudos to you guys for doing that. And thank you for the opportunity. So I'm going to go ahead and share my screen. Let's see here. Open system preferences. If it lets me.
Depending on the setup, it may make you log out and jump back in once you give it access, so you can see what it says.
Sorry, that's one thing I'm not the best at is technology.
It happens.
It's asking me about my settings. Oh, wait, let me try
Yeah,
that.
a lot of times you have to go into settings and then
I see it. Okay, it's going to make me leave and come back.
yeah, that's fine. So, Jen, what have you been up to?
I just want to say thanks to all the folks that are on, live with us. And just as a reminder, it is a CME credit. So, make sure your colleagues and whoever else you talk to, just remind them that it will be posted. It will be in the portal, in your member portal with questions, and you can submit it for CME. So that's a benefit to being able to have it recorded and then watch it back and then answer those questions. But we do have a solid handful of folks on here, which is always awesome. Even though we can't see you guys, I just wanted to make sure that we acknowledged, that you're on here with us, which is awesome. We'll give Christina just a second to go ahead and hop back on. Looks like she's back, which is great.
Right.
Okay.
Can everybody see that okay?
There we go. Yep, you're good.
Perfect. Make that a little bit bigger. Is that better? Nice. Okay. So one of the things that, Tom kind of spoke about that I really want to take the time to speak about is not just on mental health, but really how we've created this integrative health home here in Jacksonville at my facility, and why that has become, I think, such a pivotal move, and really just builds off of what the medical society and what CrossFit, I think, is shifting towards and going towards. And that's bridging this gap between healthcare providers, physicians, gyms, CrossFit gyms and coaches, as well as the community. And that's something that we've embodied here. And I'm pretty excited with what we've created over the last 5.5 years and some of the work that we've been doing. And I wanted to kind of share that with you all today. So when like most people, I started my journey going into an affiliate and never left. Here we are almost 11 years later for personal reasons, my own mental and physical well-being, and then naturally just learned and saw the progression of what could be done with an affiliate, having that attached and working in conjunction with a lot of the work that I'm doing as a mental health provider. So I was a mental health provider first, and like most people, part of the clinical world, the bureaucratic system. I was in academia, and it really just wasn't for me. And so I knew that there was more and better ways that I could help people. And I started my private practice, and then eventually led to opening an affiliate and integrated those two. I do believe in person-centered care, and I think that in order to call yourself that and to really truly use an integrative health model, it's important to understand that that requires all pillars of health. So we have to be looking at the whole person, both mentally and physically, and even spiritually and nutritionally. So I think this is something that we all, kind of share the sentiment of that we really see that there's this broken system and it's more incentive for sickness, and the money lies in waiting for you to get sick, and it's just really ineffective and expensive. Whereas the model in which that we all are starting and trying to provide within much of these outpatient health homes, if you will, becomes a lot easier for us to truly address the root cause and fix that broken system, by providing the things that we know help people fundamentally. So I kind of view this as like a paradigm shift needed, and I think that's something that we all can agree upon. I think that's why we're all here and part of this society, is to truly help people to be healthy, and knowing that an integrative approach would be inclusive of a complete treatment plan that looks at both medical, mental, and physical health parameters. And I think that we would all agree that that includes gym owners and coaches having a seat at the table, as well, because they're an intricate part of that treatment plan and that support system for the people that we serve. So you thinking about this, that's something that we kind of created, and we wanted to do a different approach. And so we thought, it's got to be able to be a system and an approach that fundamentally looks at root cause issues, not necessarily the reactionary symptoms. We have to be able to educate and empower our community and teach them how to take back control of their health, to be advocates for themselves, and to work with these healthcare professionals like yourselves and myself, and create an independent system that fosters actual health and well-being. So again, it took a while to do that, and our facility has essentially evolved over the last couple of years. I will be the first to admit it is not easy to collaborate care with a bunch of professionals. Like, everybody, has their thoughts and their philosophies. And so this is not something that I think is easy to put together by any means. It's something that I'm still working on, as it comes. And we have people who will come in and out, and it takes a little bit of time to find the right fit. But one thing that I think is really cool is that we've created this ecosystem that utilizes this collaborative approach, and it's viewed as a one-stop shop. So there are multiple ways in which the clients will funnel into our facility. They could come through any one provider, or they could come through the CrossFit gym. But the key is that, one, all the providers are on the same page. We share the similar philosophy of health approach. We inter-refer to one another whenever possible, and we collaborate that care. And we're communicating as much as we possibly can, keeping in mind all of those parameters such as HIPAA and, confidentiality and things like that. So there's lots of layers to this. And again, we're still working on making progress through some of those pieces. But what we've been able to do is address and show these members that fitness, physical recovery, nutrition, and mental health are very important to their overall well-being, and not just tell them, but show them. All of our providers hold a CF level 1 or higher, in addition to our coaching staff. So what is really cool about that is when you all have that background, you share that philosophy and understanding of CrossFit being the methodology of choice and a way of health to move our bodies, and knowing that movement is medicine, moving correctly. And so there is this shared, there's this shared philosophy and the shared value in that really makes it so easy to get along and to have the goal of the client's well-being first and foremost. And I think that is important, because I have had in the early stages providers who were into CrossFit but not necessarily have a credential, and there's a difference there in thought. And I quickly learned that having someone who actually has the credential and has gone through the level 1 or the level 2 or higher just sees things differently, and they live their advice. They are out in the gym, they are exercising, they are doing CrossFit with the community, as well as supporting that in making that part of the treatment plan whenever they're working with someone. So that's been something that's been a game changer that I think, moving forward, we've kind of all agreed that that would be a requirement for us, for the fact that that's a really important part of this model. And I do believe that, having seen the success and what we've done, that this really is what the future of the health home looks like. And I can envision that a lot of communities and CrossFit affiliates will be taking on a similar model where they have these types of services. The one thing that I do see, I mean, I hear about some of these pieces being in CrossFit gyms, which is really cool. But the one thing that I do consistently see a deficiency in that I'm hopeful that that will change, and I can personally even be, sort of a sounding board and even a role model for, is encouraging my fellow mental health care providers to create those relationships with CrossFit affiliates. And that's something that I've done with Nicole Coyne as my partner, doing some stuff with a course that we designed to help educate and include mental health as a part of the conversation and as a part of how we work with our members in the gym. And I think that that's something that we're a little bit behind on. And I get why there's still quite the stigma attached to mental health. But, if the games and some of the last couple of years, COVID, there's so many examples we could cite that just shows how important mental health needs to be a part of this circle of care. There's so much evidence there. So I'm excited that there's more support and more destigmatization around it, and we're going to see more of it coming out and normalizing that process, because we all know that that's something that we all have. And for us at our gym, like, that's our base of our pyramid, is mindset and mental health, because without that, it really makes everything else so much more difficult, in terms of talking about relationships with self, with nutrition and food, all of those things. And I could go on and on of a list of issues that fundamentally come back to root cause of stress and mental health. So that's a little bit about what we've done. This is who we are. There are 4 entities underneath our roof and the services that we provide. So our gym is called CrossFit Tailwinds, and we provide CrossFit nutrition services. The mental health and mindset coaching is through a practice that is also there. And then we have a physical therapist, PT Works, and the Movement Collective is our chiropractic care services. And through our nutrition services, we do, hormone health and testing and things like that. That's something that we're getting ready to start. So this really is all inclusive of healthcare at this point, both mental, physical, and recovery practices. And these are the people that I've been very fortunate enough to work alongside and share this passion with. This is my team, just to kind of put some faces to some names. We also have 5 coaches that are on our staff right now, including myself would be 6. And many of these practitioners, not all of them, but many of them are also coaches. So they all have a CrossFit credential, as well as practice, as well as workout, and some of them even coach in the gym. So their faces are always present throughout the day as they're coming in and out of their office and taking a break and getting some fresh air and saying hi to, to the members and so forth. And it's really great because it really personalizes the relationships on another level. And that is important. We know, at least in the mental health care facility, the mental health care realm, and I'd imagine this is probably important in most of the patient, doctor or healthcare professional industries across the board, is that rapport is so important. And for us, it's 5 times more likely that someone's going to be successful in a therapeutic setting, and we have research to support that, than whatever approach we're using. That becomes insignificant compared to the type of relationship that we have. And that's why I think CrossFit is so amazing, because it really does promote those intricate, close relationships, unlike most fitness modalities that exist. So it's this next level relationship. It's this rapport building where we are really personalizing our clients and our members, and being able to, practice what we preach and create these and foster these relationships in the gym and in the healthcare setting, that break down some of those clinical barriers that keep us at a distance. That being said, there's so many other layers to it being in an outpatient way. You're talking about more time being spent with them. So we're not pressed. These guys are not pressed for 20-minute, 15, 20-minute sessions with their clients. They're able to do full hours, whatever time frame they want to get to know their clients. So they're not bound because they're all cash based. The therapy does do some insurance, but everyone else is pretty much cash based practices here, and that affords them the opportunity to become more aware of what their clients need and create and foster those relationships to really help them, figure out the issues. And that's something that you just, it's just undeniably a difference maker compared to that turn and burn revolving door that happens in clinical settings where we don't, as practitioners, have as much control. So I did want to talk about a couple of cases just to kind of bring to light all of what I've just said. I've got 3 here, and I'll just kind of speak to them. Everyone that comes through doesn't necessarily always use every service, but obviously we try to encourage that, and they'll come and funnel in a different way. And as you build rapport and as you help break down those barriers, you're able to encourage the different services at which time that person needs it. So we have a 46-year-old male that I wanted to talk about because this guy, he had started CrossFit before he came to our gym and was already on his journey, and then he moved with his family. So he had already lost probably about 80 pounds or so before he got to us. And then his goal was to continue to be able to do, work on his weight loss journey. He was overweight, and he simply said, I just want to be able to walk up the stairs side by side with my wife. That was really important to him. And so he started, and he came funneled through the CrossFit gym. And then over time, we were able to do some of the mental coaching with him because this is a veteran. He suffered from PTSD, had a lot of those symptoms that made it really hard for him to focus and for him to sleep. Sleep was a major issue with this person. And so through some of that, we were able to improve his sleep. He went from sleeping like maybe 1 to 3 hours a night to getting a solid 7 to 8 hours regularly, which was huge for his mental health. I mean, some days he'd be borderline like delusional because of the lack of sleep and the nightmares. So through some of our ruck and talk sessions that we do with people, which is very different, we do use movement in our therapy process. We were able to help him overcome a lot of that and unpack some of that trauma that he had been carrying around and improve those mental health markers. The tension that comes from just inability to sleep and the excess weight and some of the just tense muscles, the harboring of the trauma in his body did require him to need some release. So the physical therapy became very instrumental in doing that. So again, it became this combination of approaches where we were moving his body, we were helping him to unpack some things mentally that he needed to let go of, and physically releasing some of the pain, and then eating better, which we know food and mood is highly connected amongst many other things. He was able to improve his diet, and he and his wife were able to walk up the stairs together. So just a great success story, and really excited for what it's done for him. And he'll tell you he's so grateful. He goes around talking about us to anybody who will listen because he knows how profoundly of an impact it has saved his life and changed his life in ways that nothing ever could. And they've wanted him to be on medications and all these things, and he's very he just refused. He was like, I don't need medication. And kudos to him, because there are lots of people who get to that place where they are just so frustrated and so worn down because nothing is working, they will succumb to anything just to relieve, the pain and the stress that they're in. And he refused to do that. So it was really cool to watch his journey and see him get to a good place and see him continue to grow. 2 other people we have 2 females, a 56-year-old and a 35-year-old. Awesome stories for them as well. Very anxious people. Anxiety was a big thing for them. And through CrossFit, and again, these services, which is almost all of the ones that we offer, that's why I'm highlighting these particularly, because it was the culmination of these services that really helped them to move. Now, they funneled in different ways. One came through the 56-year-old female came through the mental health first, and then the 35-year-old came through CrossFit as well. But the 35-year-old was suffering from so much anxiety that she was breaking out with shingles regularly, to the point where she was almost on FMLA because she was having to call out of work, and she was just having these just stress outbreaks from these shingles. Having utilized these services, she was able to go from regular breakouts to not having to call out of work. And she's had them like maybe twice in a year, the last 2 years, where she was regularly having almost like every 6 weeks at one point. So changing an environment and utilizing these services and understanding the importance of health and stress management and lifestyle changes significantly changed the course of her life, and she's not breaking out in shingles anymore. I mean, that's insane, how much stress impacts our body. The 56-year-old female, just a walking ball of anxiety, just crippling anxiety, just lack of self-worth, no confidence whatsoever. We were able to get her into groups of people, CrossFit. This is somebody who avoided people, and this person within a year's time just totally leaned up, gained confidence, gained muscle, um, decided to go back to school. I mean, I like unrecognizable, from being so timid to being outgoing and smiling and just feeling like herself. And so it's just incredible to see that people come through, and CrossFit is great, but when it's accompanied with healthcare and we talk about health in the right way and we show people what they can do and their potential, particularly the capabilities that they have mentally and in their mindset, it just unlocks all the potential and possibilities that they can physically do. And that skill set translates into their everyday life. And they're going out and they're forging healthy relationships, and they're connecting with their spouses, and they're going after education late in life. I mean, 55 years old, she went back to school, all of these wonderful accomplishments, reaching what I consider like their true potential. And that's just a hidden superpower that many people don't get to tap into, simply because they don't have the right resources and the right people surrounding them to show them. And that really just showcases why I'm such a proponent of this particular model of the style of health home. So just some benefits that I kind of mentioned: stress reduction. We're definitely improving muscle mass and making people physically stronger. Lots of people gaining confidence, and therefore reducing anxiety and taking more control over their life. Decreased physical pain. We know that anxiety and trauma just tenses the body, and people harbor and hold on to pain so much more than when they're in a relaxed state. Even if they are CrossFitting and moving, they're not fully releasing that tension. So it's really important that we're working on that mental health and mindset as well. Improve sleep, improve relationships and confidence. And something that I think is really cool that we're seeing, we've used some wearables in some of our work that we've done. We're seeing this improvement in HRV, which is very much directly related to vagal tone, which is something that not many people talk a lot about, but mental health practitioners might understand that a little bit more. And we're simply talking about this correlation between improving your heart rate variability and regulating your nervous system, where we have a better regulation of that sympathetic and parasympathetic state, which is simply just transfers over to better health because you're not stressing as much and you're able to be activated at normal times, but realize that there's not a saber-toothed tiger running after you all day, every day. And just having that ability to, rest and digest at the end of the day when it's appropriate. So that's been really cool to see as well from just a scientific standpoint, and if anybody's like a geek on that stuff. That being said, our goal is to provide and continue to provide this person-centered holistic healthcare to our community and improve their health and well-being. And that's something that I think that we're doing a pretty good job of. And I'm really, like I said, proud of the people that I'm working with who share this passion. And I'm excited to share this with you all. Happy to answer questions or connect with anybody who has questions about how to do this. I've been doing that with some people, particularly the mental health professionals, but if there are healthcare providers or physicians that also have questions about how to connect with us, totally a total opportunity there, I think, and would be a difference maker and a differentiator for your community compared to other models that exist without it. So that's what I have.
Oh,
I can
that was
you stop
fantastic,
sharing.
Christina. Yeah, thank you. I have a couple of questions. I'd love to hear more about Ruck and Talk and where that came from and what the origin story of that. I think it's such a fantastic idea. I mean, any of us that have spent time walking with a friend know that we tend to open up almost unconsciously when we're out walking. So can you talk a little bit about that?
Sure. So that really came out of COVID, particularly when we were, believe it or not, we were told, at least here where in my state, there was an article that came out that said, hey, mental health providers, you can't sit in an office with people, but you can go outside and walk with them.
Wow.
And I was like, okay. I mean, it makes sense, fresh air, and we love it. And I'm all about movement. And again, this kind of goes back to a long held stigma that, like, when you do therapy or when you do any kind of mental coaching, everything has to be in a room, super confidential. We can't talk about it. Like, nobody needs to know what we're doing. And it's like the secret society of what we're doing, which is just insane. And it puts up all these barriers that make you feel like you're doing something wrong or there's something wrong with you. And so it was really cool to see this evolution of, yes, you still have to abide by like certain things and take those things into consideration to protect your client's confidentiality, but like you can get out and actually move around with them if that's what they want to do. So, I like to ruck. I'm, CrossFit, rucking is not, foreign to us. And I said, I think this would be great to take people for some walk and talks, and depending on their level of fitness, ruck and talks. And we do work a lot with military and veterans and, first responders. And so that's something that they are, accustomed to and probably can resonate with. It's a lot easier to walk side by side with someone on their journey and talk with them and break down those barriers than it is to sit across from them and be awkwardly staring at someone who already is nervous and apprehensive about being there. So it's one way in which I think it makes it a little bit easier just to let things go. And when you're moving, because you've got the benefits of nature, right? So the nature provides that natural relaxation and promotes just feeling calm, accompanied with focusing on rucking and moving. You're less focused on what you're saying and who you're saying it to. And because you're not staring across the room at them, they're next to you. It feels like you're on this journey together. And there's just a lot of symbolism that goes along with that.
Yeah.
And we found that people just did better and easier and they really enjoyed it. And they're like, yeah, can we go rock and talk? I'm like, absolutely. So I'm definitely getting my steps in.
That's amazing.
But I'm setting off fireworks apparently.
That's unbelievable. Great timing too. That was beautiful.
I'm going to interject with a question that was in the chat, and specifically if it reflects back on the Ruck and Talk and or just the way that you bill or set up payment structures for other types of services. The question specifically is, do you bill for something like that, which I'm referring to kind of the Ruck and Talk scenario, and does your liability insurance care? And I think for providers and or affiliate owners who have the opportunity to watch this back, right? They're not on here for the live, but they have access to it. Understanding how to structure additional services that your affiliate might be offering that might touch into the healthcare provider bucket is a question that we get asked a lot from owners. And then also for providers who want to connect in the affiliate space, but also have questions around liability insurance for themselves as providers, or how that would then go into, the affiliate owner space. So any insight you have as to what has worked for you for any of those, I think is really helpful information.
Yeah, no, that's great. So a lot of our clients are self-pay. Depending on what services that you're using, they're not billable. Rock and Talk is billable through insurance. We can do that. We keep it to a 45, 55, 60-minute session. So you still have to meet the time requirement, but that is something that you can do. You do have to have your liability insurance, but it does go with you. I've looked into that. So wherever I go, that goes with me. We have a space, particularly with like near our affiliate, where I can do the talks and carved out like a mile or, and walk around. If you're on like a busy street and stuff like that, that's probably not going to be as conducive. So I would also say, look at your state. Because that's Florida, and that's CPH is the liability insurance that I use, which is a common one for mental health providers, but it does go with me, and I can do those ruck and talks billable through insurance. That's not an issue.
Yeah, that's amazing. I think the one thing I would add to that too, that I think you were alluding to, and I love this about that approach, is that you are stacking multiple therapeutic modalities, right? Because the science behind forest bathing and just being outside, right, and what that does for your HRV and for your immune system function in particular is really rather impressive. And even just 20-minute sessions in a wooded area has measurable impact that you can see on biomarkers in your blood panel. And so spending 40 to 55 minutes, walking outdoors, not just the therapy work that you're doing, but you're supporting that, right? From what I like to say is a bottom-up technique where you don't even have to think about it, where you're actually improving autonomic nervous system balance and immune system function is really, really powerful. So that's really a great idea.
Yeah. We're the only ones in Jacksonville. We teamed up with Go Ruck and got some ruck packs, and they loved it, and they love to support it, and it's been awesome.
That's really cool.
And no, I couldn't agree more. And people would just, because of all the things you just said and that I said, that they respond well to it. It's got a somatic experience feel to it. And mental health professionals would know this, like Bessel van der Kolk is very big on the trauma healing side of our world. He talks about how movement is so important to healing of trauma, and specifically rhythmic movement, which I believe CrossFit is, and being able to go out and rock and move, and getting your clients off the couch moving is the best thing that we could do. He literally says that in one of his speeches, and it's so profound. And I think that's where the opportunity between, what we do at CrossFit and what mental health professionals have done can come together, and they can learn from each other and help each other out.
Yeah, it's so funny, right? It's like our paradigm, when one of the most beneficial things that we can do is get you up and move and get you outside, is to lay you on a couch in a room and close the door and the windows. Right? So it's so fascinating how backward we can be sometimes.
Yeah, but all of our providers hold their own insurance. They're required for their own practices. So everybody has it. And then, the gym has it. So that's definitely a requirement for all providers. You would need that.
Christina, can you talk a little bit about Mental Fit and kind of what that is, and if people want to learn more about how to incorporate that into their affiliate, where they would go, what they would do?
And then I have a follow-up question about the providers you work with also.
Okay. Yeah, so Mental Fit grew out of this, integrative model, this person-centered model. It really is an eclectic approach to working with people to help them become mentally and physically fit. And that's really true, getting to the best version of yourself. Kind of utilizing the CrossFit sick, well, fit continuum, and just adding to that. I love a lot of Glassman's methodology, obviously his founding principles. And I've just sort of taken that and really added the mental health specifics to it and built off of that a little bit more and expanded upon that. So when he talks about, the greatest adaptation being between the ears, well, I agree with that, but I think it's more than that. I think it's, the greatest adaptation is where the mind and body intersect. Like that is the real crux of the opportunity, where mind and body come together and function optimally. You're just your best right there. That's like amazing. And that's really what mental fit is about. It's trying to bridge that gap, and it takes that somatic experience, that a lot of the principles that you know of just in the mental health world, and bringing that to light and making it more experiential and helping people to just be the healthiest versions of themselves. So I devised a program around that I use, and like a protocol with my clients when I do the mental fit program. I've also utilized that more in the last like 2 years, particularly with some of our high performing athletes that I've seen, high functioning people, CEOs, runners, athletes, and so forth, because it's the same concept that they need. It's this missing piece. Everyone gets to this bottleneck. It's like everything's going great, and then we stagnate and we can't get any further, and it's because there's this piece missing. So we start to incorporate some of these mental health components and really help them to optimize their abilities, and that's when you start to see the superhumans come out.
Yeah.
So I've been doing that, and I partnered with Nicole Coyne to create a mental fit and mindset course out of this approach, and it essentially outlines how to bring this conversation, this topic, into the gym, how to empower you as a gym owner, coaches, and even these concepts into the gym affiliate itself, and essentially bringing those conversations and those practices to working with your clientele. It's all about that. It is 7 CEUs approved for CrossFit, which is awesome. It's the first mental health CEU approved CrossFit course, which was pretty cool.
Yeah.
And we've had a number of gyms go through it, and I've been able to work with them to help them to incorporate some mindset work into their program offerings. So it's a retention tool, right? Because if someone's depressed, if someone's anxious, they're not coming to your gym. They're going to just isolate. They're going to shut down. They're going to find other reasons. It's that fight, flight, or freeze, response. And they'll see this as a luxury. Or if they do come in, now we have a different issue. We have the issue of we're using this as not a tool for health anymore, but a form of avoidance. And now that's become weaponized because we're harming ourselves because we're not dealing with the issues at hand. So it's no longer, a positive association, and intention has everything to do with it. If we're not moving with intention, it doesn't matter what you're doing. It can be used to be more harmful than good, even things that we know that can be good.
Yeah.
And that includes the gym. So
Amazing. And that's available on the APN if people want to learn more about it, or where can they find mental fit?
it's on CrossFit CEU list of courses as well. And it's also on my website and on Healthy Steps Nutrition HSM Mentoring's website.
Awesome. That's great. Jen, did you have something else?
Yeah, so I wanted to elevate just philosophically your approach in general, right? And I think that that's, practitioners that are part of the CFMS already can probably align in their profession and how there's correlation between, maybe what is learned or the standard application of their specialty, but then also how it can kind of cross over and embrace a lot of the foundational methodologies of CrossFit and that. So I want to elevate your specific platform, right? Because I think that that's awesome. But operationally, I think we all might have philosophical things that we can agree on that are important, but now we get to this bottleneck, right? Where how do we take this and organizationally create a system that can benefit more people through these approaches, right? And so the way that you connected with your providers, right? Because you have CrossFit and you're the affiliate owner, and yes, you're also the provider that can function in the mental health space, but you do have other specialties under, in that realm, physical therapy and prior chiropractic care. Tell me a little bit about how you connected with those providers, right, to kind of create this, large scale interpretation of health in your health home. Like, were they CrossFitters in your gym? Did you reach out to them? Like, how did those connections come? Because that application of connections with providers is really important for affiliate owners to understand as they look to make these health homes, right, in their communities.
Well, I'll tell you, if the if the CrossFit Medical Society existed a couple years ago, it would have made my life a lot easier to find these people. So I do think that there's definitely an advantage now having this central location of providers. where you can kind of go as, especially as this grows, to be like, okay, well, who's in my area? And like, I wonder if they'd want to team up and connect. And I like what they have and, you know, what they're doing. And that sounds like it resonates with me because you think philosophy, personality, you know, like goals, all values, all those things are important. And it's hard when you have a bunch of professionals. So you really have to be able to find people you can work well with. That's not easy. But back when I started and I didn't have you guys, uh, really it became just word of mouth, connections in the community. People heard about me. They heard about my affiliate. They knew what I was trying to do. Um, and it was like somebody in our gym who was a member knew somebody who was you know, a PT and looking for a home and said, "Hey, I've got this person. Do you want to meet them? This is what they do." And I said, "Yeah, I'm always open to talking to anybody." So if anything, it just becomes another connection in the community, even if it's not a good fit for my health home. But that's how I met our PT. I met, it's all through mutual connections, like just word of mouth, people who know
Community.
what you're trying to do and connect you, honestly.
All right. No, that's good. And I like the realization that community and connection is important, right? Even in the professional landscape. And I think too, and you know, the onus is on us as providers kind of in the medical society already, and then the continued sharing of what can be possible with more providers that come in here, and that is internetworking within themselves, right? And with the affiliate owners and stuff that are looking to make connections, not necessarily just refer patients for care, right? But it's the possibility of understanding what can be created, right, with connecting like-minded professionals with each other, just like we do that in our community, right? It's communities of like-minded individuals within the CrossFit space, but that can exist in the professional world as well. So I just wanted to appreciate your insightfulness of creating something like
Yeah.
that in your space. That's really great. Okay, so a question real quick, and we are getting close on time, so we'll definitely make sure that we're going to answer this question, but this might be a stretch. Any ideas how primary care physicians can use your methodology in our mental health consults? So I'm assuming that Patricia is a primary care physician looking to embrace the methodology with mental health consults. And Patricia, if that's an incorrect interpretation of your question, please go ahead and add in the chat, but I'll toss it back to Christina.
Yeah, that's a great question. And you know, we've actually wanted to connect with a physician. That's something that I think would be a great addition to like what we're doing. And I would encourage that. I think if you think about it, like generally speaking, and this is just having conversations with physicians, those questions just aren't asked. We're not necessarily going into a lot of the mental health questions. And again, because a lot of the times they're stretched for time, it's about how many people you've got to get in a short amount of time. So you're very limited on what you can do. Now, if you're doing, and you know, if you're not in the system and you have more control and you can, you know, doing something like what, you know, you're doing, Tom, and you have the ability to have more time with them, then you can ask these questions. And I'm happy to help devise, you know, um, a questionnaire or to talk about what those questions might be that are so important. But we definitely want to be asking questions about stress and, you know, mental health and what you've done, you know, to work on your mental health. Anything specifically? Have you been to therapy before? Are you on any therapeutic medications? Like all these things are very important questions. And I even think affiliates have an opportunity to have like a basic health questionnaire for purposes of safety and liability. Like you need to know what people are on or what they've done before they, you know, start to work out. Like that's just a general questionnaire that we should know these things.
Yeah, I think a couple of things that I would expand kind of on the question there. You know, in regards to a primary care physician, you know, utilizing that program to work with their patients, I think the answer is a wholehearted yes. And then I think the question to the provider is going to be, okay, well, what is the format and how do you want to execute on that, right? Because if you're a physician in primary care, you know, certainly working and treating patients for depression or anxiety is within your scope, right? And so if you also happen to have an L1 and you're a coach and an affiliate and you want to incorporate mental fit into that and lead that charge at your affiliate, like you can do that.
Mhm.
And if you get coverage, right, to cover you, it's really not that expensive to do that for primary care services outside of your practice. You can do it, and you can do group ruck and walks, and you can
Mhm.
do individual sessions, and you can lead the course in the affiliate. And the great thing about doing this work, and it's the other point that I wanted to make, is that especially for all of us physicians and doctors and other allied healthcare professionals, we have a lot of OCD in us, and we think that everything always has to be perfect. And a lot of times that will keep us from doing anything. And if there is anything that I've learned, going through this journey and creating health homes at, a few different affiliates, is that identify the easiest first step and take it, and that you build more as you go, and it can become more complex and robust as you go. But don't let the fear of the overwhelming potential keep you from taking the initial step. And the great thing about it too, as Christina was alluding to, it's like you're making these relationships. You want it to be a two-way door, because you may do a couple consults or a project with somebody like, yeah, that's not the partnership for me. Or
Mhm.
you may do it and you're like, wow, this person is a great fit for me. We work really well together. Why don't we do something else that's a little bit bigger and a little bit deeper of a commitment? So just wanted to make those points.
Yeah, and I'll say, I don't have all the answers. And the beauty of this business model is that one, everyone's winning because they have control over their services. They can do the care they really want to do, which is so important. And because we have these specialties we all bring to the table, we learn from each other. So if you can put your OCDs aside and you can come curious and want to learn and not be afraid to ask questions that you just don't know, like mental health related questions to the mental health professional you're working with, that's where the beauty is in that collaboration as a team. And I love that. We've learned so much from each other. I mean, we just sit there sometimes. I mean, we do get busy, like everybody's doing work, but we do try to take time, and we do sit down and have these meetings throughout the year and collaborate to say, okay, what can we do to support each other? What do we need to do to keep getting this message out? How can we help each other? If people want to come and visit the facility, I try to let the providers know and make them available so that if someone's coming in to visit us, another healthcare professional, we're all getting an opportunity to meet this person and forge a professional relationship. Um, so there's just so much that comes out of that from a business standpoint, and even just from, a learning standpoint. And that's nice because it makes me feel good that I don't need to know all the answers because I've got someone I can consult with and I don't have to be nervous about that anymore. I mean, that's a lot on an affiliate owner or a coach's shoulders to know all of these things, and they just can't.
No, it's a really good point. Awesome. Any other questions in the chat, Jen? Anything else we need to?
Nothing else popped up. Personally, I loved all of this, not only because it touched on such an important aspect of healthcare, which is mental health, in general, but also some of the questions that just got surfaced in terms of how to create these individual expressions of health homes in our communities and allowing us all to understand that it can look and feel different for everybody, but there are resources to at least start the conversations, because we are all collectively, whether you're a provider, an owner, a coach, or all of those things, potentially stepping into a space that there is no rule book written on it yet. And I think like understanding that it's okay to try and potentially fail and or redirect or pivot or add a door that goes in a different direction. Like this is how we will all continue to create the new version of what it is we are all pushing towards together. So I just thought that this was a really great, it touched all the things. So Christina, thank you so much.
Oh, you're welcome. Thank you. And to your point, when you're pioneering something, because this is not something has ever existed, you're bound to make mistakes, failures, learn from it. I mean, we are really leading the charge on this, so it's inevitable and it's part of the process to kind of figure some things out and improve along the way.
Yep.
So,
Yep,
Christina,
you got a thank you from Sarah. She said, "Thank you. Nice to see you again.
oh,
Love all your work." So just wanted to share that. So.
before we
thank
wrap
you.
up, Christina, I'd love for you to take just 2 minutes. I think yesterday was National Suicide Awareness Day, if I'm not mistaken. But for a lot of us who are healthcare practitioners of different specialties, but also maybe coaches in the affiliate, if you think that an acquaintance or a friend or somebody in the gym is struggling, can you give a couple of recommendations about how to approach that with the person, how to potentially talk with them to check in to see if they're okay, or how to identify resources to make sure they can get what they need?
Yeah, so the sort of scenario I usually kind of role play out is, you know, your members best. You know when behavior changes, and that's one of the key indicators when they don't seem like their normal self. So I think it's really important when you see that to check in on them. This goes back to the relationship point,
Mhm.
um, because you're going to be the first one to notice. And it's just a simple, hey, how's it going? Just wanted to check in on you. You don't seem like yourself today, Tom. Is there anything you wanted to talk about? And if you're kind of like wavering, I'm like, hey, look, you know, I'm your coach. I care about you. I'm always here to support you. Happy to go into the office or step outside if you want to have a private conversation. You know, seem like maybe something's on your mind. And ask some of those like circular questions. Like, you never want to go up to someone and be like, hey, what's wrong with you?
Mhm.
That's probably not the best approach, but just more of like a care and curious way. If
Mhm.
they do unload on you something, well, one, if it's imminent danger, then we need to get them the help. That is your responsibility to do that. Man, I've got all the emojis going today. What is happening over here? Um, you certainly want to get them, you know, help ASAP. That's why we have emergency contacts on there, and maybe need to get them to the hospital, you name it. So definitely want to crisis manage. If it's not, and it's more like just, you know, tough times are going on. Hey, Tom, you know what? I really appreciate you sharing that with me. It sounds real heavy. I'm sorry you're going through that. Have you thought about talking to someone about that so you don't have to carry that around? That's a lot, man. And you know, you kind of tell me whether you are or you aren't. If you're not, I'm going to say, you know, look, I think it could be really helpful for you to talk about that. You're going through some stuff. I want to be a part of your support system as your coach. I care about you, but that is something that is going to be like above and beyond this gym. And in order for you to be your best self, like let's expand the support system and get you in contact with someone. It's not an either or. And then I'm going to go and I'm going to grab my provider list, because I have a list of providers in the area that I work with, to refer for people when they need it. And I'm going to bring it to you discreetly. And I'm going to give it to you with a little care bag that says a personal statement from me that tells you I care about you and that I'm happy that you're part of this community.
That's awesome.
And just like a little note, I'm going to give that to you and then be like, hey, is there anything else you need? And then I'm going to make a note to check in on you, because follow up is important, to be like, you know, in a couple days or a week, hey, Tom, had you made that call? Are you doing okay? How's things going? You've got to do that follow up and just make sure. So it just depends on how the conversation goes, is how I play that out. But like, first and foremost, we have to make sure that no one's in immediate danger.
Sure. Yeah, no, that's great. And
Yeah.
that's how I've always thought about it too, right? As you break it into those three buckets, like immediate danger of harming self or others, right? Which is its own unique bucket. And then the second one that you alluded to is, you know, finding them resources, which now, you know, hopefully they have those connections in the community within the gym,
Yeah.
or you can go to the directory because every state is covered now. And so
Yeah.
and then you can go, you can pull that provider, you can pull their profile, and you can give it to that person within 30 seconds. So that's one of the reasons why we wanted to have that there. So you can talk with somebody like Christina, which is an amazing value add to all of us. So, all right, I know we've been rambling. We're coming up on time.
Yes, the one more comment popped up. And so I just want to reiterate that if you do have questions about starting any sort of like mental health initiative in your community, Christina is a resource for that. So that kind of touches on that comment. And then as far as some of the other ones, and because we're over, I'm not going to go into it. I'll just leave it as, we always want to be an advocate for the community. So if there are, from a healthcare provider standpoint, so if there are things that you feel passionate about as a healthcare provider, that the medical society is a advocate for you. So if you ever want to set up an email or a time to talk about something specific to the needs of what you think you can do for your group, like by all means, like shoot us an email, and then we can kind of go from there. And this was about, some courses and some different things. So not to get pulled off topic, but just to close out, we are here, and that's what we're trying to do, is advocate for the growth of whatever we can do to serve our community. So on that note, if we're all ready to go, and Sean, thank you for tuning in. He also said great stuff, Christina.
Oh, we were
Thank
blessed
you.
by 3, 2, 1 rock, 3, 2, 1 go, Doc.
Go.
Impressive. All right. Well, thank you so much, everybody, for tuning in. Christina was awesome. Appreciate you.
Thank you.
With us. Folks, remember to fill out the CME forms, answer the questions so that you can get credit. And this will be recorded so everybody can watch it in perpetuity.
Send an email out.
What's that?
I'll email out when it's posted. So since we have to wait for the recording, but
sounds good. And journal articles will be dropping, new newsletter coming, and we'll see you guys next month for grand rounds. Okay.
Sounds good. Thanks, guys.
Yeah.
Thank
Bye-bye.
you. Stop recording.